All right, good evening, everyone. My name is Christy and I work for Medtronic. And tonight I have the pleasure of hosting this webinar where you're going to get to hear from Dr. Vincent DiCarlo. Dr. DiCarlo graduated from the University of Georgia with a Bachelor of Science in Biochemistry and Molecular Biology and a minor in Public Health. He earned his doctorate in medicine at the Medical College of Georgia and then completed an internship in general surgery and residency in urology at the University of Kentucky. He is a member of several professional organizations, including the American Urological Association, and he's even co-authored a variety of publications. Dr. DiCarlo specializes in general urology, including the treatment of kidney stones, benign prostatic hyperplasia, and lower urinary tract symptoms, as well as minimally invasive and robotic surgery for urologic cancers. He also has a special interest in treating overactive bladder, urinary retention, and fecal incontinence, which are topics that we'll be discussing tonight, along with a therapy called InterStim that helps to treat those. And as I mentioned, I work for Medtronic, and that's the company that developed this therapy. While you might not know the name Medtronic, you probably do know somebody who's had a pacemaker, and that's what we're most known for. So without further ado, I'm going to pass the mic to Dr. DiCarlo so that you can hear more about this. But before I do, just a few reminders. Everyone's phones were muted upon entry. So if you have a question, and we hope that you do, please feel free to type it in the Q&A box at the lower portion of your screen. Everyone's names remain anonymous. We will answer those at the end of the presentation. Likewise, please answer the anonymous poll questions during the presentation. And now allow me to welcome Dr. DiCarlo.
Hey everyone, thank you so much for joining us this evening, and thank you, Christy, for the introduction, and Medtronic for hosting this event. Christy, should I go ahead and close out this anonymous poll window here for folks? Is that something that they can see?
You can just exit.
Okay.
Exit out. Yep. Don't end it though.
Okay. All right. We will go ahead and get started. So as Christy said, my name is Dr. DiCarlo, Vince DiCarlo. I have offices with Georgia Urology in Canton, Woodstock, Jasper, and Ellijay. We do a couple of these procedures over in Marietta, so we included that as well. And so let's get right to the topic. These are some of the common questions that we get, or that I get from a lot of patients regarding bladder control issues. And these are just things that I hear patients say all the time. You know, will I ever regain control? How can I possibly go out in public? Will I be able to wear white pants again? The bathroom is always on my mind. You know, one that really resonated with me recently was a patient who has a young granddaughter that she babysits frequently. As a parent of a 1.5-year-old, kind of hit close to home as far as she said that she has to plan all of their activities around being close to a bathroom because she's constantly worried about having to make it or having an accident. So, you know, 44% of people are embarrassed to talk about their bladder control problems, and more than 50% have incontinence and have not discussed it with a doctor. So that's a huge subset of patients that we're missing out on when there's therapies and treatments that we can offer to help with that. So, you know, from a Georgia Urology and Medtronic aspect, we think it's time for this to change for a lot of people. So bladder and bowel issues are not inevitable, meaning that, so, you know, a lot of these things can apply to patients who have these issues. So urinating frequently, more than 6 to 8 times a day, getting the have to go now feeling, like I said, planning activities around the bathroom, monitoring how much you eat or drink because of how much you take in. You're worried about having to go to the bathroom more frequently or more urgently, getting up multiple times a night. If these are things that you've experienced, your body is probably trying to tell you something, and it's okay to go in and see someone and talk about these issues. I think a big message that we have is that you're not alone, because this is such a common problem. It's really part of the aging process for a lot of people. It affects people of all ages, younger, older, and it does not discriminate gender-wise either. It affects men and women. Ignoring these issues can lead to a lot of issues with quality of life. And as we get older, I think quality of life is a huge important factor that we as physicians should try to maintain for all patients. So, loss of sleep, loss of confidence, self-esteem, poor feelings of general health. If your bladder and bowel issues are leading you to have these thoughts and feelings, that's something that we want to know about and that we should know about. And like I said, with some of these data points here, this is a very common problem. So bowel control problems affect 1 in 12 adults in the U.S. Bladder control problems affect 1 in 6 adults in the U.S. Those numbers combined are just as, if not more common than a lot of issues that people have with vision or diabetes. So it's a very common problem around the United States. Good news is that there are options. Options that can get you back to a life that you want to live, a life that you are comfortable with more control. And we're going to talk about a lot of those options. But first, I wanted to get into what causes these problems, so you guys have an idea, sort of, what we're looking at and the ways in the process that we focus on to try to improve these issues. So some of the issues are listed here. So there's some of the daily habits, dietary things that we'll touch on. Some medications or supplements can impact bladder and bowel control, as well as previous pregnancy, childbirth, or pelvic floor injuries. So how does bladder control work? And this is sort of a key slide because it sort of focuses on where in the cycle that issues can happen and what some of the treatments do. So, your kidneys produce your urine and it gets funneled down into your bladder. As your bladder fills, there's a message that's sent from your bladder to your spinal cord, and that gets processed in your brain. And a message gets sent back down the spinal cord to the brain to go ahead and empty your bladder. So breakdowns in this communication can cause bladder and bowel control problems. Oftentimes that is sort of the underlying issue. As we age, that communication and processing just isn't as smooth and gets a little discoordinated over the course of time. So a lot of the treatments that we have are focused on the bladder and preventing the bladder from processing the spinal cord message too quickly or when you do not want it to be processed. Medtronic and their bladder control therapies is sort of the only therapy that we have that focuses on the nerve issue. And I think that's a key component why they've had so much success and why their therapy is very efficacious. Bowel control works in a similar function where if the intestines get distended, messages are sent to the brain and spinal cord to go ahead and facilitate a bowel movement. Again, communication breakdowns can cause bowel control problems as well. They can often go hand in hand with bladder issues. So what are the types of bladder control problems? There's a lot, and these are 3 of the most common that I see patients in my clinic for. So we'll touch on each of these, but these are stress incontinence, urinary retention, and overactive bladder. So what is stress incontinence? It's exactly how it sounds. It's leakage of urine whenever there's abdominal stress that's put on the bladder. So leaking urine when you sneeze, cough, or laugh. Leaking when you exercise, bend, or lift, leaking when you climb stairs or stand up, or going all the time in order to keep it as empty of a bladder to avoid those issues with a full bladder. So abdominal stress pushes urine out of the bladder when you do not want it to be pushed out. Urinary retention, again, it's fairly self-explanatory. So unable to empty your bladder fully, or not being able to tell when your bladder is full, needing to use a catheter. These are some of the common things we see with urinary retention. Overactive bladder is very sort of what we're focusing on today, and it is how it sounds. It's the bladder being overactive, and it's has two components to it. So there's an urge incontinence component, which is leaking urine when you have the urge to use the restroom to urinate, leaking urine before you can get to the bathroom, and then wearing pads or protective garments to aid with those. The other component is urgency frequency. So even if you do not leak urine when you're trying to get to the bathroom urgently, going frequently more than 6 to 8 times per day, and feeling like your bladder is never empty is something we commonly see with people who have overactive bladder. And the other part of this is what is fecal incontinence, so the bowel control issues. It's similar to urge incontinence with bladder. It's the involuntary loss of stool. Sometimes people see stool present every time you urinate or stained undergarments. Even it qualifies to have uncontrolled passing of gas as part of fecal incontinence, but similar to the bladder incontinence issues. So what are the ways to treat incontinence and get back to living life the way you want to live it, and improving that quality of life that we talked a little bit about? These are 3 things that I try to touch on with all of my folks when you come in and sit down with me in clinic. Because there really are 3 phases to this, and in Georgia Urology, we've built a pathway to focus on each of these phases, so that we're sort of guiding you along a pathway and working towards or doing things that are going from the simplest and easiest and least invasive to slowly up higher up the ladder in terms of those features. So lifestyle changes, medications, and then advanced therapies. Excuse me. So lifestyle changes are simple things that you can do at home that can help improve these urinary symptoms. So I talk a lot with folks about diet and exercise. Living a healthier lifestyle, eating your healthy, exercising better can improve some of the nerve function and nerve communication. Pelvic floor strengthening or pelvic floor physical therapy is also a part of a lot of the lifestyle changes that we will work on. Avoiding certain dietary things can make the urgency, frequency, urge incontinence worse. So I'll often talk with folks about that. There's a whole concept of urge suppression and bladder training and timed urination that I will also talk about with patients when you come in and see me in clinic. Oral medications is sort of the second phase. So often the lifestyle changes can help or improve, but they don't get you to where exactly you want to be. So usually the first step after we talk about those is to get you started on a medication. Now the oral medications tend to be effective, but they don't always work, and they may cause other issues. They are daily medications. Some of the medications can have side effects. So there's a large class that has a very well documented side effect profile that includes dry mouth, blurry vision, constipation, high blood pressure. Part of the issue with the medications is that, like the slide says, they don't always work, or they don't always get you to that 100% improvement that you want to be at, or even 90% or above. So 72% of people in certain studies and other studies have sort of supported this, that says that people will stop taking these bladder medications within 6 months because they have these side effects, or the patients are not satisfied with their improvement and they just don't see the point of continuing them. And that's a big point and a big place where we in medicine and urology, I think, fail a little bit, because only 20% of patients are extremely satisfied with their current overactive bladder treatment. So that means 80% are at some degree less than that. And over 80% of patients are non-adherent to their medications at 12 months, just like we sort of talked about on that last slide. So that's a huge, huge portion of patients that we're not, meeting their goals. And, Georgia Urology as a whole is really focused on trying to improve that. There's a high attrition rate with overactive bladder patients. I think it's a combination of, it's a difficult topic for patients to talk about. The medications, like I said, have side effects, and people just think that this is a part or a normal part of getting older. And so we'll see patients in clinic often, and we have a tough time getting them to come back because maybe we haven't explained it well to them about all the options or what all we can do. So this slide sort of highlights how often patients are returning after their initial second or third appointment, and 90% are not returning after their third. So this is something that we've worked on a lot at Georgia Urology, and Medtronic has actually helped us immensely in this. We've recently developed a nurse navigator pathway, and what that is we've got people on our staff, 3 to 4 nurses who are dedicated to overactive bladder patients only. And so for our patients now, we're getting them signed up for a nurse that will be their point of contact and communication to check in with them after their first visit, see how the medications are working, see how the side effects are, talk about the next steps and the next phases, answer any questions that you might have. And if you need to be seen sooner, later, or have any other issues, then they're a direct point of contact between you, the patient, and me, the physician. And it's been, I think, a huge help to the practice. And so, moving on to advanced therapies, these are, the things that we're talking about today. So if the dietary and lifestyle changes and medications don't give you the results you expect, there are more effective options that are advanced therapies that we will talk about when you come see me in clinic. So those are listed here. The bladder control advanced therapies are the InterStim, the NURO system, and then injected medications, and we'll talk about each of those. So the injectable medications is BOTOX. So a lot of people hear about BOTOX for cosmetic reasons, or in the world of neurology, they use it a lot for migraines. We use it a lot for bladder control and overactive bladder issues. Requires a procedure where we inject BOTOX into the bladder muscle. Its effectiveness is about comparable to oral medications. Again, it's focused on the bladder itself, not necessarily the bladder-brain communication. The one downside to the BOTOX is it creates a potential need to self-catheterize if it is too effective, meaning, there are certain patients who the medication works too well and then they're not able to fully empty their bladder. And it does also require repeat treatments or repeat injections because the BOTOX does wear off around, in the 6 to 8 month range. One study has found that about 2/3 of patients will discontinue treatment after their first BOTOX injection for a variety of different reasons. Neuromodulation of the percutaneous tibial nerve, or the NURO system, is another one of the advanced therapy options. We do offer this at Georgia Urology. It's a safe, effective, minimally invasive therapy that works by stimulating the nerve in your ankle, which travels near the nerve that helps control your bladder. And it's thought or been found that stimulation of the ankle nerve can help recoordinate the bladder nerve control. The downside to it is that it's very time intensive. So you have to come in once a week for 12 weeks and then monthly thereafter. And we would talk about sort of the pluses and minuses of that when you would come in and see me in clinic. InterStim, or sacral neuromodulation, is what we're mainly talking about, or a big point of this talk today. So this is the advanced therapy that is shown to be the most effective. It's a gentle nerve stimulation that corrects and recoordinates that communication pathway that we talked about between the brain and the bladder and the bowel to restore the function of each or whichever one you're having issues with. It is more effective than medication. Numerous studies have shown to prove that. I think the big advantage of the InterStim system is that we're able to do a test phase window where we put in a temporary lead or a temporary stimulator and allow you to go home and monitor your symptoms for 1 to 2 weeks to see how the stimulator works and see if you're a candidate for the permanent implant. I always equate it to, taking a car out for a test drive before you buy it at the dealership. So you'd hop in the car, make sure you like how it drives, go home, talk with your family about it, see if it's right for you. And then if you're happy and satisfied, you come back in and you get the real thing. There are different options. There's rechargeable and recharge free. And we would talk about sort of the pluses and minuses of each of those. So this is a very common therapy. So, a lot of people have undergone it. We do the tests either in the office or in one of our ambulatory surgery centers. It takes about probably 30-ish minutes on average. We place a small wire in the battery, which it connects to an external device that can be worn using a belt discreetly under your clothes, like you can see in the picture there. You go about your regular activities for those 1 to 2 weeks. You record your daily symptoms. And then, generally, if you see a greater than 50% improvement with the test stimulator, then it's generally recommended that, if you're happy and satisfied, that you would have improvement in your symptoms with the permanent stimulator. We would move forward with that. It is efficacious long-term, so over 80% have achieved success at 5 years. So people are very satisfied after undergoing the procedure in general. One of the big questions that we always get is, any implant or anything going in the body, is it safe to get MRIs with InterStim? And the answer to that is yes. These are all now MRI compatible, safe to use, and okay to have MRIs in the future. So is this therapy right for you? You might be a candidate for the bladder or the bowel control therapy with InterStim, with the sacral neuromodulation, if you have significant symptoms, you've tried lifestyle changes and oral medications, and you've not had the improvement that you've wanted, and they haven't given you the relief that you've wanted. It's a proven therapy, the InterStim. Patients are very satisfied. 85% who've gotten it for bladder control are happy with their symptoms and happy with their outcomes. I can't tell you how many patients have walked back into the office after they have the implant and told me it has been life-changing, and that they wish they had done it sooner. Same thing goes with the bowel control aspect for the InterStim. So, we have a lot of patient advocates with Medtronic and with Georgia Urology who can tell you about their experience. But I think for the vast majority of patients who undergo InterStim device placement, that they're very happy and very satisfied. And that concludes our presentation.